Authorities in Germany have now voiced their concerns over a reluctance to take the COVID-19 jab amongst the German population. Let's speak to Professor Uwe Janssens, former president of the German Interdisciplinary Association of Critical Care and Emergency Medicine. Dr. Janssens, thank you very much for being with us. Why are we seeing vaccine hesitancy in Germany?
Yes, you just mentioned some of the problems. In the beginning, in the end of 2020, there was a great hesitancy concerning the messenger RNA vaccines, almost in the very big group of healthcare workers. Some of them feared that these kind of vaccines could influence their genetic material or would lead to infertility. So we had to do a lot of information for medical healthcare workers, for nurses. On the one hand, on the other hand, we had to inform the population on this. So then the vaccine program started in end of December, on the 27th of December in Germany, the rollout of the vaccines. And first we started with the BioNTech vaccine, then afterwards the Moderna vaccine. And then the discussion started about the efficacy of the AstraZeneca, the ChAdOx vaccine, which was prepared together with Oxford. And many of the people feared that these vaccines would be inferior to the messenger RNA vaccines from BioNTech and from Moderna.
Which is contrary to the evidence that we're getting, isn't it? Yesterday, a study for the population of Scotland showing very high efficacy of 94% within 4 weeks of the first dose of the Oxford AstraZeneca vaccine, also high, 85% on the Pfizer-BioNTech vaccine. But given the briefings, given the tone of messaging we've heard from politicians across Europe, was this inevitable?
Yes, I think there are so many points which are very critical and crucial for the vaccine hesitancy among the population. As I can tell you, in Cologne, a very, very big town in western part of Germany, the vaccine centers, they want to apply the AstraZeneca vaccine and they have appointments and the people do not show up. I think it's a very critical point at this time. And we have to do a lot of good communication to transport the scientific evidence, which clearly shows the efficacy of the AstraZeneca vaccine, and to transport this information in the population. And I can tell you that much of the press and much of TV and much of the radios, they worked on a negative image of these vaccines. And that's, we are very, very sad about it, because we really think that the vaccine at this moment, at this time in the corona pandemic, is the only solution to get out of this disaster. So at the moment, we are very, very eagerly trying to inform the population, to inform medical healthcare workers about the safety and about the efficacy of all the vaccines which at the moment applied in Germany.
The figures, when you read them, are pretty startling. Only 150,000 out of 1.5 million doses of the vaccine were used in Germany on Friday. At one vaccination centre in Berlin, fewer than 200 people turning up for the 3,800 daily appointments. Given the damage that this virus has done, how surprised are you by the low take-up?
Yes, you see, the population, people are always very, very, very skeptic about vaccines. And in Germany, this is, I'm very sad about this. It just dries up the skepticism. And I think it's, we see that this is the result of disinformation, misinformation, and the result of many, many fake news which are transported towards the social medias. And I think the medical societies on the one hand and the politicians on the other hand, they couldn't get the good information to the people. So you see, we know that you have to have confidence in the vaccine. And this is a very, very critical point. The people are not whatever the reason is, confident in this AstraZeneca vaccine, which really proves to be much more efficacy than the influenza vaccine, for instance. And now the data are showing up, and you just mentioned it, that after just one dose AstraZeneca, after 90 days, there is an efficacy, severe COVID, about nearly 100%. So we must convince the people, we must try to talk to them and say then, come on, get the vaccine. And I remember that in the beginning, end of 2020, in my own department, there were some of the nurses and healthcare workers who said, I don't want to get vaccinated. So we started a program within our hospital, about a nationwide program for healthcare workers to enhance the acceptance of the vaccine. And we could show within online surveys that the skepticism gets down. In December, it was 50% said of the healthcare workers, the nurses, no, I don't want to get a vaccine. Now we are only 25% of them saying, oh, I'm very critical about it. So we are getting near to the point that to the 100% acceptance of the vaccine.
Where do you stand on the debate of whether healthcare workers should have a choice in this matter? Our chief medical officer was asked about this yesterday at a Downing Street news conference and talked about a professional responsibility to protect yourselves and others when you are working within the health sector.
Yes, we had some of these discussions in Germany in the beginning, January, and all the end of year of 2020. But I can tell you, and it's a worldwide phenomenon, that healthcare workers show some hesitancy about vaccine. That's not only the problem, I think, in Germany, many other countries, and there are some very good studies showing in the center of the epidemic, corona epidemic, that healthcare workers are some way reluctant. So they think that the studies were done too fast. They think that the messenger RNA in the beginning could influence their fertility or their genes. So there are some very fancy reasons to do not accept, but to say to them, you have the obligation to get the vaccine, I think that would lead to a very, very big, much more hesitancy to get the vaccination. So I think the ways to convince people to tell them that the vaccination has a very, very good efficacy without any serious adverse event. And we must have the publicity, the news, the radios and the TV to improve the compliance of anyone in the population, and not only the healthcare workers. In Germany, in January, 54 accepted to say, I get the vaccine, and that's not enough to get rid of the SARS-CoV-2 virus.